cannabinoid therapy has huge potential to influence other treatments that patients are doing. So to keep them most compliant, it is especially important to make sure they understand the importance of their endocannabinoid system and how it functions. So the best way to describe to a patient how the system actually works and why we're using this as an adjunct to other treatments that they're doing is to help them understand what is actually happening in their system. So first and foremost, the endocannabinoid system can be considered the regulator of the regulations. Every single system is influenced by the endocannabinoid system. Our immune system, our gastrointestinal system, our lymphatic system, our cardiovascular system, our circulatory system, our endocrine system, everything is regulated by the function of the endocannabinoid system. So each one of these, if we think of each person, each patient as a mobile, like one of those mobiles that we put in a baby's crib, and it has the bar that keeps balance so that it's able to spin evenly around the baby's head. So we can think of all of our systems in the same manner. Our circulatory system, our kidneys, our liver, our spleen, our stomach, our digestion, everything. So what happens when something falls short or a deficiency presents itself and we take some sort of medication? So say, for instance, we have an injury and we break our foot and take a medication. So what happens is when we take that medication for the foot, we're influencing the immune system's response to the inflammatory reaction, and this puts an off balance at the system level. This is the symptom level. We take a medication or an anti-inflammatory, and now we have off balance. That's temporary. We didn't fix anything at the systemic level. We put a Band-Aid over the symptom. So say we have inflammation, so we take another medication over here. Same thing. We're not fixing at the system level, we're addressing a symptom. So now we've got another imbalance over here. And that influences everything all the way up until we get to the very top. And that's typically when we start to develop disease. The higher up we get, the more systems that are involved, the more areas in need of attention, the more off balance we are, and then we lead to a cancer diagnosis. So we don't necessarily use this as a cancer treatment. It is to bring balance back to all of the systems, to encourage homeostasis in all of these systems so that we maintain this balance at the system level. Otherwise, we're working our way all the way up the chain with emotional traumas, with inflammation, with improper digestion, and we've got imbalances all the way up the chain until now this person has developed cancer, heart disease, some other form of disease. So what cannabinoid therapy is, why we're using CBD, is because it brings balance back to the system. The main question is, why does it work for everybody? Why does it help somebody with a stubbed toe, with a paper cut? How can it possibly help somebody decrease the intensity of or the frequency of their seizures? How does it help somebody with epilepsy? And why is it going to work for somebody with cancer? So whether we notice the response that our body has or not, cannabinoid therapy, CBD, is actually bringing balance to all of the systems. So this is the way we describe it to the patients. Instead of taking something to manage these symptoms, we're going to take CBD. The patient's going to consume CBD, and it's going to have a trickle effect. It's going to restore function at all levels. It's going to bring this even balance, for as even as my art can possibly be here. It's bringing balance to all systems, and this goes hundreds and hundreds of levels deep. This is just a generalization and an easy diagram to draw for a patient to show them that essentially it's hitting at all systems, not symptoms. So that's the best way to make patients understand. It helps them be more compliant if they feel that they have a better understanding of what it's doing, rather than, well, I may have felt something, or I may not have, or did I not have. So giving them information so that they can also share this appropriately with other patients and with their family members is going to help us help them. The more they know, the more they understand, the more compliant they're going to be, and the more effective this treatment is going to be, and the more it's going to enhance all of their other therapies. So if you have any other questions, let me know. Please excuse my art. I'm not an artist. I'm a CBD educator. So if you need a better picture, I'm happy to do that. Or if you have a better picture, send it to me and I'm happy to use it. Have a good day.